My name is Maria Angeles Lopez Olivo, assistant professor in the Department of Health Services Research at MD Anderson Cancer Center.
Well, welcome to Rheumatology Network. I'm glad to speak with you today. We wanted to talk with you about your recent study in ACR Open Rheumatology. The study was called the Psychosocial Determinants of Total Knee Arthroplasty Outcomes 2 years after surgery. So would you mind telling us what the goals were of your study?
So we conducted this study to determine the demographic and psychosocial factors in patients with knee osteoarthritis that would be present before a total knee replacement and were associated with a worse outcome 24 months after the surgery, namely knee pain, worse function, quality of life, and satisfaction.
Mm-hmm. And what did you find?
So our findings were several for each one of these outcomes. We found that older age, high body mass index, low tangible support, which is the concrete support or the direct ways in which people assist others, and also low optimism were associated with high levels of pain after 24 months after the total knee replacement. The same factors were associated with worse function. And we also found, in addition to these factors, that increased stress was also associated or was a predictor of worse function after a total knee replacement.
Mm-hmm. And how significant were your findings?
They are very important because they highlight the factors that can be targeted to create interventions to improve these outcomes. But we also, I failed to mention that we also found that there were some factors associated with worse quality of life. So we found older age, high body mass index, and increased number of comorbid conditions that were associated with worse quality of life after 24 months after the total knee replacement, specifically in the physical component, which includes pain, function, and limitations in daily activities. Depression and low optimism were also associated with worse mental quality of life. And we also found that having a dysfunctional style of coping with things, namely people in denial, avoidance, disengagement, or even people who self-blame tend to have lower satisfaction with surgery at 24 months. So anyways, these findings are important because they highlight also that within the factors that we found, there are modifiable and unmodifiable factors. So unmodifiable factors like older age and increased number of comorbid conditions, or even body mass index, because sometimes it's difficult to decrease. So these unmodifiable factors may be targeted in a more intensive way, or given rehabilitation for longer periods that can help prevent worse outcomes in this type of subpopulation that have these factors. And the other thing that is very important to remember is that patients need to be advised to lose weight before going total knee replacement. And finally, for those factors that are modifiable, such as optimism, coping style, or depression, it would be important to screen patients before surgery so they can be informed, provide resources, and redirect these type of behaviors.
Mm-hmm. These findings sound familiar. I'm sure they have been published. Similar studies have been published over the years. And why is it important that we continue to study the psychosocial determinants of outcomes like this associated with knee surgery?
So there are contrasting results. So then there are still some areas which they are not certain, and this study highlights, some of the factors that have not been discussed previously. Specifically, talking about the coping styles that are dysfunctional. There are a few information about that in the literature, and also we evaluated other factors that, even though were not associated with outcomes at 24 months, they are known to be associated, in shorter periods of time.
Mm-hmm. So how will this, or how could it affect how physicians treat or interact with their patients? How will your findings? Mm-hmm.
So it's important that physicians are aware of the factors that can be modified, and provide resources to modify, or, to, as I was mentioning, redirect this type of behaviors, and always make sure that the type of factors that are not modifiable, there is some sort of intensive intervention, rehabilitation, for example, that can at least improve these outcomes in the long term.
Mm-hmm. So are there any key takeaways that you would emphasize to our audience? Any other key points you'd like to make?
Screen after, before, screen before a total knee replacement. Always trying to find this type of people that are going under depression, or have coping styles that are not going to be very helpful for them. And then the other thing is, advise always patients to lose weight.
Mm-hmm. Now, obviously, if a patient is not healthy enough for the procedure, for example, if they're morbidly obese and there are comorbidities, the surgery might be rescheduled until those things are under control. But if a patient was to present with depression or poor coping mechanism skills, would the surgery then would you recommend it be postponed as well until the depression or whatever issue they had, it has been addressed?
Well, that's up to every clinician to determine, but it would be important to at least acknowledge the patient has this. Most likely, there are tons of resources or interventions that we can apply to these modifiable factors. So it would be important to intervene even if the patient is going to go under the surgery. Mm-hmm. So these factors in the short term, may be not relevant, but then we are, showing that in the longer term, they may be important, because when we ran exactly the same analysis at 6 months, as a preliminary analysis, we didn't find, these important factors such as optimism, related, and neither, depression. But it means that later on, in the short term, well, the pain, everything is fine, but then 24 months after, they may be relevant. So that's another thing to consider.
Okay, well, thank you. I appreciate your time today. We wish you the very best, and we look forward to featuring your work again in the future.
Thank you.
All right, thank you.